All right, well, good afternoon, and thank you for joining us for this media availability with Public Health. Dr. Ferrer will be giving some remarks, followed by a time of questions and answers. If you would like to be put into the queue to ask a question, please click on the hand icon, which is in the participant panel on the lower section of that. You can also send me, the host, a comment, and I will add you to the queue. After questions, we will be making remarks in Spanish, and that will begin at 3 o'clock. With that, I would like to turn things over to the Director of Public Health, Dr. Barbara Ferrer.
Thank you so much, and good afternoon, everyone. Thanks for joining me for today's briefing. This afternoon, I'll be sharing an update on cases, hospitalizations, deaths, and vaccinations by age, race and ethnicity, and geography. I'll also provide updated information about the Delta variant in LA County, information on our efforts to improve vaccine access and build confidence in the vaccines, and updates on breakthrough cases. I'm going to close with strategies for protecting workers and workers' rights. I'll take the first slide. We are sad to report 11 additional deaths today. 10 of the people who died had underlying health conditions, and this does bring the total number of deaths to 24,525 in LA County. We share our deepest condolences with those of you who have lost friends, loved ones, and family during this most difficult time. We're also reporting 839 new cases today. This is a 165% increase over last week, and it brings the total number of cases in LA County to 1,254,354. Our daily average case rate has now jumped to 3.5 cases per 100,000 people, and this also is an increase from last week's case rate of 1.74 cases per 100,000 people. There are 296 people currently hospitalized with COVID-19, and we have 48 open investigations at residential congregate settings and non-residential settings where there's at least one confirmed case of COVID-19. To date, more than 7 million people have been tested and had test results reported in LA County. Our daily test positivity rate is now 2.5%, an increase from last week's test positivity rate of 1.2%. We'll go on to the next slide. This graph shows trend lines in cases, hospitalizations, and deaths in our county from March 1st of this year through June 30th. We do continue to see an uptick in cases and hospitalizations. Deaths, fortunately, continue to be relatively low, but as hospitalizations continue to increase, we anticipate that deaths might also increase. We'll take the next slide. The rises in cases and hospitalizations that we're seeing are not distributed equally among our residents. On this slide, you can see the age-adjusted case, hospitalization, and death rates among all racial and ethnic groups over 2-week periods, ending first May 29th, and then the second period ending June 26th of this year. When we look at the rates of new cases, we can see that over the month preceding June 26th, cases began to increase among all racial and ethnic groups, although the most significant increase was among Black residents, where the case rate increased from 38 cases per 100,000 people to 65 cases per 100,000 people. That's an increase of about 170%. We also saw case rates rise by 122% among Latinx residents, 137% among white residents, and 166% among Asian residents. Over the same interval, while hospitalization rates decreased slightly, around 20 to 30% amongst Latinx and white residents, hospitalization rates have been trending slightly upward by about 5 to 15% among Black and Asian residents. Death rates, fortunately, have not followed the same pattern, decreasing by a substantial proportion across all of our racial and ethnic groups. Past increases in hospitalizations have generally led a few weeks later to proportionate increases in deaths. I'm hopeful, however, that with the very high vaccination rates among older residents and many of those who have underlying health conditions, that we won't see such a large increase or proportionate increase in deaths following this increase in hospitalizations, but we will need to wait and see what the data tells us. Even without the same level of threat to the healthcare system as we experienced during the surge, these rising case rates and disproportionately increasing case rates among Black and Latinx residents are concerning, and they do require targeted action to prevent bad outcomes among those who have already frankly suffered the most. Slowing transmission back down is our best protection against viral mutations that create more dangerous variants. We'll go on to the next slide. Knowing that there's additional risk among those not yet vaccinated, and that includes the 1.3 million children under 12 and the many teens not yet vaccinated, we're closely monitoring transmission rates among children and youth. This graph shows the spread of cases among children younger than 18 years by race and ethnicity. While we're seeing, again, similar to a pattern in adults, increasing case rates across all groups, the case rate in Black children, indicated by the orange line, has been rising much faster than the case rates in other groups. Since May 31st, the case rate amongst Latinx children rose from 15 to 21 cases per 100,000. That's about a 40% increase, while the case rate amongst Black children rose from 15 to 65 cases per 100,000. That's a 430% increase. As transmission increases across communities with lower vaccination rates, those that are not yet protected by the vaccine remain very vulnerable to becoming infected, and this includes children and teens. This is particularly true if there's more gathering with unvaccinated friends and family, especially in indoor settings. This data serves as an important reminder about the need for masking and infection control among those not yet vaccinated. With good prevention measures, almost all of this transmission can be stopped before it starts. We'll go on to the next slide. With the recent rise in cases, tracking the proliferation of variants of concern remains a priority as we seek to better understand the factors that may be contributing to increased community transmission. Lately, we and the rest of the world have been watching particularly closely for Delta variants, which were first detected in India and which are now estimated to comprise about half of US cases. We're especially concerned about this variant because it appears to be highly transmissible. That is, it's more contagious than even other highly contagious COVID variants. And because there's a concern that it also may cause more severe infections than other COVID variants. While emerging data affirms that fully vaccinated people are well protected from severe infections with Delta variants, people that have only one vaccine need to know that they are not as well protected. And there's also evidence that a very small number of fully vaccinated individuals can become infected and may be able to infect others. This slide shows the variants that are identified by both the Public Health Lab and a group of other California labs from 7,289 specimens that are linked with LA County residents. Delta variants are represented in this bright yellow and the bright yellow that's in the bars on this chart. And you can see we started seeing small numbers of Delta variant cases among LA County residents back in early April. And we're continuing to see an increase in Delta variants as a proportion of variants of concern obtained by our sequencing. On this chart, you could see that the Delta variant has been the most commonly sequenced variant in LA County since the beginning of June, and it now accounts for the majority of variants of concern that are identified by the labs. We can go on to the next slide. This trend line shows the trajectory of the Delta variant among specimens sequenced by all of the labs that were serving Southern California, including the LA County's Public Health Lab. The number of sequences collected between June 20th and 26th that had Delta variants isolated was 63, and that's 54% of all of our sequences that were collected that week. And you can see that on this blue trend line on the table. Because the decisions on which specimens to sequence are often driven by the management of outbreaks or by an effort to understand vaccine breakthrough cases, we're not able to generalize from these data to the broader population. But as we've noted before, the rising proportion of Delta among sequence variants of concern is consistent with what other parts of the US are seeing. And for certain, it represents increased circulation of the variant. Given that we've got still slightly under 4 million residents in LA County not yet vaccinated, the risk of increased spread remains very high. Take the next slide. One of the fears that some have about the Delta variant is that fully vaccinated people will not be as protected from infection with these variants as they are against other variants of COVID. The data to date suggests that this is not the case. This slide compares the vaccination status of LA County residents among those whose samples yielded any of the top 3 variants identified during the month of June. The most compelling information from this table is how very few people who are fully vaccinated are infected by the variants. The orange part of the bar represents all the unvaccinated folks. And this is true even though fully vaccinated people are more likely to have had their specimen sequenced than those who are unvaccinated, because we absolutely try to sequence samples from everybody who's fully vaccinated to better understand the source of infection. It's also important to note that overall, the proportion of post-vaccination infections was similar across the variant types. Among the people whose samples yielded Delta variants, about 11% were fully vaccinated. You can compare that with 9% of Alpha, that's what we previously called the UK variants, and 7% of the Gamma variants, and that's what we previously called Brazil variants, and 11% of all our other variants. The differences among these percentages are really too small for them to be statistically significant, and they don't suggest that there are large differences in the risks that the variants are posing to fully vaccinated people, which is really quite minimal. We'll take the next slide. The data that we show week after week continues to make it increasingly clear that vaccines remain the most important tool we have to keep COVID transmission and the incubation of variants low. Although vaccination administration has slowed, we are still making some progress, as you can see on this slide. As of July 4th, we've administered nearly 10.6 million doses of vaccine across the county, including almost 5.9 million first doses and nearly 4.7 million second doses. This means that about 5.7 million LA County residents have received 1 dose, and about 5 million are fully vaccinated. Among LA County residents 16 and over, 69%, really almost 70%, have received 1 dose of the vaccine, and 60% are fully vaccinated. Among our seniors 65 and older, 88% have received 1 dose of the vaccine, and 77% are fully vaccinated. We can go on to the next slide. While millions have done their part by getting vaccinated, we continue to see fewer folks than we'd like to see getting their first doses of vaccine week to week. As you can see from the vaccination trends represented on this slide, between June 28th and July 4th, we administered close to 60,000 doses across the entire county network. And while the number is likely to increase because of the lag in reporting, it is highly unlikely to reach the 100,000 doses we're hoping to administer each week. As cases increase, the urgency to get more people vaccinating is rising. We'll take the next slide. Although it's disappointing that overall vaccination numbers are lower than we need them to be, there are continued increases in vaccinations among younger age groups. As of July 4th, 39% of our 12 to 15-year-olds have received at least 1 vaccine, as have 54% of youth 16 to 17. Meanwhile, vaccinations in the 18 to 29-year-olds rose to 57%, and the percent of 30 to 49-year-olds vaccinated rose to reach 65%. Next slide. At the same time that we're seeing these rises in cases and hospitalizations disproportionately affecting children and adults of different races and ethnicities, we're also seeing gaps between these groups when it comes to vaccination. For individuals 16 and over, 45% of Black residents and 54% of Latinx residents have received at least 1 dose of the vaccine. And we're not really seeing, as you can tell on this table, very significant relative increases in these groups. And that makes it difficult to make progress closing the gaps. 62% of American Indian, 65% of white, and 76% of Asian residents are vaccinated. We'll go to the next slide. When we look at age groups by race and ethnicity, as we have on this slide, we continue to see the same troubling gaps among teens and younger adults that we've been noting over the past few weeks. Among both the 12 to 15 and the 16 to 17 age groups, between 1/4 and 2/3 as many Black and Latinx teens are getting vaccinated as their American Indian, Alaska Native, white, and Asian counterparts. The data also continues to show a significant gap among young adults, 18 to 29-year-olds, where 28% of Black adults in this category and 43% of Latinx adults have been vaccinated, compared to 76% of Asian residents and 58% of white residents. This disproportionality persists among our 30 to 49-year-olds, and in this group, about half as many Black adults have been vaccinated as their Asian and white counterparts. It's particularly worrisome to see persistent gaps among young and middle-aged adults because they make up such an important part of our workforce. And many of them are also members in communities where, as I've just noted, cases are rising. Building vaccine confidence and taking sensible public health actions to provide protection to unvaccinated individuals in these groups remains one of our highest priorities. The next slide. The most powerful way to protect those in hard-hit communities, many of whom are, as I noted, our essential workers, is going to be to close the vaccination gaps. However, as you can see on this slide, those gaps in health outcomes persist and are widening between groups. The age-adjusted case incident rate in Black residents is 65 new cases per 100,000 people, and that's 2.5 times the incident rate in Latinx residents, whose case rates are themselves 2.5 times those among Asian residents. The age-adjusted hospitalization rate in Black residents is 9.3 hospitalizations per 100,000 people. That's almost 2 times that of Latinx residents and more than 5 times as high as Asian residents. The primary reason that we anticipate explains this gap is going to be reflected in the differences in vaccination rates. 75% of Asian residents are vaccinated compared to 45% of Black residents. These overall trends are also going in the wrong direction for everyone and are particularly concerning given the proliferation of the Delta variant. Right now, people have the lowest levels of protection from this virus in the communities where transmission is the highest, but among all of our communities, transmission is going up. We'll take the next slide. I mentioned earlier that the disproportionality in our cases tracks with the disproportionality in our vaccination rates. And I've shared data that shows the differential burden that's borne by people based on race and ethnicity. The maps on this slide show that these gaps also track by geography. On the left is a map showing the percent of people in each LA County community that's received at least 1 dose of the vaccine as of June 16th. On the right is a map showing the 14-day case rate per 100,000 people in each community as of a month later. As you can see, the areas with the lowest percent vaccinated, and you can see some of this, we tried to highlight some of the areas in the red circle on the left, and these are indicated by those lighter shades of brown, are the same areas with the highest case rates in the red circle on the right, indicated by the darker shades of green. And this information is available on our website, and you can look at it yourself. You can look at it by the community you live in or a community that you're interested in better understanding both the vaccination coverage rate as well as the case rates. We'll go on to the next slide. To close these gaps, we're going to need to continue to make sure it's as easy as possible for eligible LA County residents to get vaccinated. And for that reason, we continue to offer vaccines at so many different places across the county. This week, there's 767 sites that offer vaccinations, and this includes our pharmacies, clinics, community sites, hospitals. We have some schools that are heavily involved now with permanent sites. And you can see that many of our vaccination sites are also concentrated in areas that have been hard hit by the pandemic. You know, as a reminder, you can obtain vaccines at all of the county-run sites, the LA City-run sites, just about every mobile site, and most of the community sites without any appointment. Many sites are open on the weekends, and they do have evening hours. So please check vaccinatelacounty.com to find a site near you. We can go on to the next slide. And as always, one of the primary strategies is being able to bring vaccines to where people already are at. And that makes use of the mobile vaccine teams. And these are just the county-sponsored mobile vaccine teams. So I want to remind folks that there are lots of other healthcare providers as well that have their own mobile teams that actually augment the work that our teams are able to do. We on the blue markers here represent the 173 sites where mobile teams are offering vaccinations this week. The number's a little bit lower than it's been in recent weeks, but that was due to the Federal Independence Day holiday that occurred earlier this week. The mobile vaccine teams continue to work with employers, businesses, and community organizations to bring vaccines to places where residents are gathering or workers are gathering. There's a form on the website for anyone to request a mobile team, and we do encourage employers and event organizers to let us know as soon as possible if they're willing and able to host a team. We can go on to the next slide. But in addition to bringing, to having established and mobile sites in the neighborhoods where they're needed the most, we've also been conducting door-to-door outreach to let residents know about vaccination opportunities, particularly to let them know about 3 of our newest vaccination sites. Between late June and early July, staff from our vaccine sites and groups of community health workers from partnering community-based organizations visited dozens of businesses and hundreds of residents at their homes near our 3 new vaccination sites. One's in Commerce, one's in Norwalk, and one is at Ted Watkins Park. The stories that we hear from these outreach teams about the results of their work affirm the effectiveness of one-on-one vaccination education. One team reported an encounter with a business owner whose store they visited. The gentleman later came to one of the vaccination sites with one of his employees that had questions and concerns about the vaccines. Members of the vaccination team were able to talk with the employee about the effectiveness of the vaccine and explain the history of the mRNA vaccines and how they work. The employee ultimately decided to get the vaccine then and there, to the resounding applause from all the staff and the other residents that were getting vaccinated at the site. As one of the staff members recalled, and I'll paraphrase her words, it was truly rewarding knowing that we didn't necessarily convince this client, but educated her well enough so she felt comfortable making an informed decision. Hopefully, she's able to tell her story to others and pass along good information about the vaccines to friends and family. We'll go on to the next slide. And this is, I think, one of the most important ways to be able to build trust in the vaccines is have lots of people willing to share their stories and to be able to have access to really good information about vaccinations. I just want to also note that through all of the vaccination sites and our mobile efforts, we are making progress in getting vaccines to residents in the zip codes that have the lowest scores on the Healthy Places Index. And many of you are familiar, we haven't really shown this slide for a while, but I think it's important to note that we remain committed to improving vaccination rates in communities that really have the least amount of health affirming resources. And we're administering a larger percent of doses to people living in communities with fewer resources compared with California overall. The light blue bars represent LA County's percent of administered doses for the week of June 28th through July 4th. The dark blue bars represent LA County's cumulative percent of administered doses. And these orange bars represent California's percent of administered doses. On the left are the allocation of doses to what we call those people who are living in communities that in fact have the least health affirming resources, and for us have in fact also been the hardest hit communities. For the week of June 28th through July 4th, the network of providers in LA County administered 44% of doses to people living in communities in this lowest HPI quartile. Cumulatively, LA County's administered about 33% of all of the doses to residents in these hard-hit communities. And we do remain focused on equitably bringing vaccines and high-quality health information to all of our residents and in all of our communities, with a particular focus on those communities that have been hard hit. Next slide. And as we noted last week, we're watching very carefully and will be reporting on a weekly basis the proportion of fully vaccinated people who test positive, are hospitalized for, or tragically pass away due to COVID. This graphic presents these numbers in LA County, and again, a reminder that the circles here are not to scale. We looked at positive tests in the group of more than 4.6 million LA County residents who achieved full vaccination status from the time we began vaccinating in December through July 6th. Among those fully vaccinated people, we identified 2,822 people. Remember, it was 4.6 million people who were fully vaccinated. We identified 2,822 people who tested positive for a COVID infection, contracted more than 2 weeks after they were fully vaccinated. That means that about 0.06% of all fully vaccinated people tested positive for COVID. 195 people, or 0.004% of those fully vaccinated, were hospitalized for COVID infections contracted while they were fully vaccinated, and 21 people, unfortunately, passed away from their infections. And that's about 0.0004%. These numbers remain very similar to the numbers we saw when we last looked at post-vaccination infections last week, with a very tiny increase only in case rates that went from about 0.05% to 0.06%. We'll be watching these closely in the weeks and months to come and continue to provide regular updates. Next slide. Because we're so grateful, particularly now with the rise in cases, to everyone who does their part to protect themselves and their communities, we are continuing to extend thank you gifts to residents who come in to get vaccinated. And I want to express my gratitude to our many partners who work so hard to improve vaccination coverage across the county. We appreciate the support of our sports teams, event venues, and local attractions in helping to encourage those not yet protected to get informed and get vaccinated. Beginning tomorrow through next Thursday at county-run vaccination sites, LA City sites, and St. John's Well Child and Family Center sites, everyone 18 and older coming to get a vaccine will have an opportunity to win one of 7 packages of concert tickets. Prizes will include tickets to see Celine Dion, Grupo Firma, Kane Brown, Luke Bryan, and Dan and Shay at the Staples Center. And there are also box seats to 4 classical concerts at the Hollywood Bowl. We greatly appreciate the generosity of our partners at all of these fabulous attractions. With their support, 7 lucky people will get to enjoy both protection by vaccination and a thrilling show at an iconic LA County venue. You can see the official rules on the county website for details. And over the next week, please make time to get your vaccine. Go on to the next slide. Earlier this week, we posted some new documents to the guidance section of our website outlining worker rights and employer obligations. We're hopeful that the new fact sheets make it easy for businesses to provide safe environments for their workers. The fact sheets include business requirements as well as best practices. As the document with the purple header indicates, our county health officer order requires businesses to report clusters of 3 or more cases among employees within 14 days to the Department of Public Health. And it requires masks for unvaccinated and partially vaccinated individuals indoors. This document also summarizes the requirements of Cal OSHA's emergency temporary standards, which among many other directives require employers to have a written COVID-19 prevention program, provide unvaccinated employees with face coverings and ensure that they're worn indoors or in a shared vehicle, document the vaccination status of their fully vaccinated employees who are unmasked on the job, and provide respirators such as N95s to unvaccinated or partially vaccinated employees upon request. The document with the green header lists the rights of workers, which include the rights to training on COVID prevention, access to personal protective equipment on the job, time and materials for hand washing, free COVID testing during work hours, and paid leave in the event of isolation or self-quarantine necessitated by workplace COVID infection or exposure, as well as the requirements for documentation of vaccination status. We continue to emphasize that workers' rights to safety are important because workers need to be able to do their jobs without unnecessary risk to themselves, their families, and their friends. COVID remains a highly infectious virus that is easily transmitted, particularly indoors, among those not yet vaccinated. The good news is that protecting workers is not that complicated. Mobile teams are available to come to workplaces to offer vaccines to unvaccinated employees. Masks and respirators are in good supply, and our team at DPH is available to answer questions and address concerns. Let's please continue to take care of each other so that we can get back to slowing down COVID-19 transmission across the county. Thank you, and I'll take your questions.
As a reminder, if you have a question, you can click on the hand icon, which is in the participant panel, or send me, the host, a message via the chat. Our first question will come from Claudia Pascuda with KNX.
Hi, I'm wondering if there's any data on people who have had COVID, not been vaccinated, and then been reinfected, and whether there's any evidence that perhaps those numbers might be going up with the growing spread of the Delta variant. Thanks.
Yeah, thanks so much. We don't have that data currently on a large enough sample here in LA County. It's a very good question. I mean, there's national data that shows that natural immunity definitely wanes over time. So if you consider the fact that we had so many people infected during the surge, but now we're 6-7 months away from that, it makes perfect sense that many people who were infected perhaps during the surge may be getting reinfected now. I think we need to look towards the national databases for better information on that. That's captured in a more rigorous way. But thanks for that.
I don't have another question right now, but that may change.
Thank you. We can go on to the next question.
And that'll be from Patrick Healy with NBC News.
Hi, Dr. Ferrer. Please talk about this startling increase in the daily case rate. But first, if you would clarify, I believe you said this is up 165%. Over what time period are we talking about? But in any event, you were talking about a doubling of the case rate last week. So clearly we're in a period of exponential growth. What does this mean?
Yeah, thanks so much, Patrick. Obviously, a really important question given the concerning data that we're presenting. Taken, just on its own, out of context of all that we've gone through and lived through in terms of COVID transmission, when you see this, first what was a doubling of cases in 1 week, and now obviously a tripling of cases this week, just with this one day, it is important for us to recognize that between the case numbers increasing significantly and the test positivity increasing significantly over a very short period of time, we have increased transmission. And it's likely that this reflects a few different things. First, increased circulation of the Delta variant for sure. All of the evidence indicates that this variant is by far the most infectious variant of concern that we've seen yet. And in fact, is as much as 2 times more infectious than the Alpha variant, what we call the UK variant, which, for us was one of the most infectious variants we had seen. And I've shown that it now is circulating widely here and across the rest of the country. We do have a fairly high vaccination rate, and that's providing us with a lot of protection for people fully vaccinated, but we also have lots of people not yet vaccinated. We're a large county, and so the numbers are staggering in terms of people who are at risk of being able to get infected. So you couple a more infectious variant with still significant numbers of people not yet vaccinated. And as I say, 1.3 million children under 12 not eligible to be vaccinated. With our full reopening, where we're being, where we're able now to enjoy many of, sort of the joys of summer without the restrictions that we had earlier, there's absolutely more opportunities for people to be gathering with other people. And when all those people, or many of those people, are unvaccinated, we can have more spread, particularly if that's happening in indoor settings, whether those are indoor work sites or those are indoor gatherings. A significant number of unvaccinated people indoors with a highly contagious Delta variant circulating makes it fairly easy for this vaccine to be transmitted, and transmitted at higher rates than we would like to see. Obviously, we think there are protections that are available right now that would help us get back to slowing the spread. And that's the good news. We didn't have the vaccines before, and they are the most powerful tool for really dampening almost all of this transmission. In many ways, COVID-19 has become a vaccine preventable disease. So the first line of defense for everybody 12 and older is obviously to build your confidence in this vaccine, get good information, and come in as soon as possible to get vaccinated. And for those who are not yet vaccinated, you need to go back to doing what we were all doing before we had vaccines. Wearing masks is required indoors for everybody who's not vaccinated. And we continue to stress that it's pretty easy for all of us to protect the large number of unvaccinated people by wearing our masks as well, even if we're vaccinated when we're indoors. And we can also go ahead, if we're unvaccinated, and move as many activities with other people outdoors as possible, keep our distance, and absolutely maintain a good hand hygiene. So we've got tools, and the tools we have at hand will be very effective if we all are able to use them.
Thank you, Doctor.
Thank you, Patrick.
Great. Next, we'll go to Ron Lynn with the LA Times.
Hi, Dr. Ferrer. Thanks for taking our questions. I was wondering if your wrist is doing okay. Just to see how you're doing. But we
Okay, yes, my wrist is fine.
okay. We do have 3 questions for you today. Just a preview, imagining what the fall might look like, the issue of vaccinated people possibly spreading the virus, and any ideas about boosting up vaccination. So first, so we're seeing, it's a complicated story that we're seeing. We're seeing historically low cases and hospitalizations. Our deaths are among the lowest they've been over the past 15 months. But then, as you said, we're seeing a doubling of the positivity rate, a tripling of the case rate. And as you said today, deaths might go up. So can you talk about how LA County might look like by the end of the summer? What's the worst case scenario? I'm guessing it can't be as bad as last winter. What's the best case scenario, and what's the most likely scenario? 2, you've talked about how a number of fully vaccinated individuals can become infected and may be able to infect others. Specifically, is there anything you've seen in your epidemiology in LA County that suggests that vaccinated people are spreading the virus to unvaccinated people? And finally, you've said that building vaccine confidence is key, but that can be a slow and deliberate process. Given the persistent gaps in vaccine uptake and the increases in cases and hospitalizations, is there anything else in the county's toolbox to get more people vaccinated quicker? Thanks.
Yeah, thanks so much, Ron. So let's just start with your first question, which of course is in many ways the most difficult, which is what do we see happening and by the fall, what are the best case scenarios? What would be indicate a serious challenge for us here in LA County? What do we think is most likely? We do continue to make slow progress on getting more people vaccinated. And I'm going to keep going back to that because our vaccinations are the most powerful tool. So in the best case scenario, we make steady progress. We actually continue to hit, that marker of at least 100,000 new people coming in every week to get vaccinated. As we get closer, I think, to the FDA giving full approval for vaccines. I think that will also help build some confidence, and hopefully that happens in the next 2 months. And, you know, we see this steady progress being made, particularly in places where we have the biggest gaps in vaccine coverage. So, you know, that is, you know, the best case scenario. We really get to herd immunity, and we get there, you know, sometime by early fall. You know, the worst case scenario is that we see a drop off in people getting vaccinated, and we continue to see a proliferation of the Delta variant, which means that for unvaccinated people, the risk just keeps going up as there's more community transmission. And that would mean, you know, unfortunately, we would have increased illness amongst many communities that have already been hit hard. And at some point, this translates as well to some increases in deaths. I'm confident that we are not going to see what we saw last fall in terms of just the overwhelming heartache of so many people dying over a very short period of time, primarily because many of the people at highest risk have in fact been fully vaccinated. And for people at high risk, this disease was devastating. We have obviously, however, always have had people at lower risk who in fact have passed away from COVID-19, very healthy people who in fact have passed away. So the risk is not zero for unvaccinated people, and our numbers indicate that. You know, we continue to see people who pass away from COVID-19, and they are frankly here in our county, you know, 99 points, I think 8 or 0.6% of them are still people who are completely unvaccinated. So this is where the risk is for us. You know, the most likely scenario for us is that we continue to make slow and steady progress, that people get back to, if you're not vaccinated, get back to being very comfortable taking those public health precautions that will work when you don't have a vaccine or you're not able to get vaccinated, which means, you know, really masking up a lot, keeping distance, and using good hand hygiene, good hygiene in general, to avoid as much transmission. We're obviously going to stay very focused on workplaces so that we don't have a lot of transmission happening at those workplaces. We have our inspectors out all the time, giving good information to all places of business so they understand how easy it is to report to us if they have cases, so that we can quickly come in and work to prevent large outbreaks. And so, you know, there are strategies that we've used all along that we will continue to use to protect those people not yet vaccinated. But I think you're right that, you know, at the end of the day, the work in front of us is to improve confidence in these vaccines among people who are not yet vaccinated. And, you know, we will try lots and lots of different strategies with all of our partners. The most successful strategy to date is making sure that people are getting their information from other people that they trust, and working to build out those teams of folks that are in the neighborhoods that can be trusted and have good information remains one of the most important strategies. So we'll continue to do that while we make sure that access remains as easy as possible. And in terms of the last question about, you know, how risky is the world for fully vaccinated people, and what do we know ourselves amongst fully vaccinated people being able to spread the virus to somebody else, even if they're just mildly ill, because obviously our data shows that very few people fully vaccinated get very ill. There is, you know, we do have teams that are out there working especially closely in our nursing homes, but the numbers are very, very small, and it's complicated to tease apart the web of close contacts and the sources of possible infection because of the long incubation period. So we rely very heavily on what researchers and scientists are telling us, which is that there have been articles now written, information from other health ministries, particularly in Israel and the UK, that have shown, in fact, that very small number of fully vaccinated people have in fact been able to transmit, but the numbers are tiny. So the protection that these vaccines offer everyone is so much greater than any of the possibilities that fully vaccinated people are going to be a main source of transmission of variants at this point. That's just not likely. And there's no data that indicates that that's happening anywhere.
Great. Next, we're going to go to Josh Haskell with ABC 7.
Thanks, Dr. Ferrer. I know that you just said that the protection is so much greater if you are vaccinated, but can you just go over talking specifically about the Delta variant? Is that the case in regards to the Delta variant, because that percentage that you showed earlier was higher than any of the other variants? And also, my second question, why do you think other cities and the state of California have not followed LA County and put out the mask recommendation for indoors, even if you were vaccinated?
Yeah, thanks so much, Josh. Well, let me start with the first question. The numbers are super small. I showed that table that talked about the Delta variant, the Alpha variant, the Gamma variant, and then all other variants they kind of pulled together. And what you saw was very small numbers in all groups of people fully vaccinated who in fact became infected with one of these variants. So when you see, for the Delta variant, I think it was 11% and it was like 9% for the Alpha variant. Because those are such tiny numbers, if you were to look at this using some statistical tools, you would find out that your confidence intervals are huge, and actually there's absolutely no difference between these groups. As we get, more, higher numbers of both specimens that get sequenced, and also because there are higher numbers, you'll see higher numbers of breakthrough infections. We'll be able to really assess whether or not there are some real differences here. But right now, I would say your chances of, a post-vaccination infection for the Delta variant are very similar to what your chances were for that happening for the Alpha variant and the Gamma variant, as well as all other variants that we've been sequencing for. And I want to note again, it is complicated to present this data because of the way we sample and go ahead and process the specimens. Pretty much we try for every single breakthrough case, every single case that we have a positive test result for people who are fully vaccinated. We try our best to be able to get those samples sequenced because again, it's really important to understand, as you're asking this question about, is there more likelihood of people who are fully vaccinated to become infected with the Delta variant than either some other variant or just what used to be the dominant circulating virus here in LA County? So to answer that question, we try to make sure we're actually sequencing just about everybody who's a breakthrough case. But then because these are convenience samples, you're also, in some ways, you're really skewing these results because you're oversampling those people who are actually breakthrough cases compared to people who are unvaccinated or don't have full vaccination coverage. So I would say again that, these numbers are very, very small, and they really indicate that these vaccines provide powerful protection against the variants. And as we noted last week, we don't do this analysis every week because we have to contact all the people who are infected. But as we noted last time, we had really talked to most of the people, 90% of the people who were fully vaccinated and infected with the Delta variant. And we found out for that 90% that, there were many of them that had mild symptoms, but in the entire group of the sample of folks, nobody ended up in the hospital and nobody ended up passing away. Again, numbers are very, very small, but they do really speak volumes about for now, how protective these vaccines are among the viruses that may be circulating, the variants, as well as what used to be our dominant virus strain, what's circulating here in LA County. So I'd just encourage everyone to focus on the fact that if you're fully vaccinated, your chances of getting infected are really, really small, even with the Delta variant floating around.
All right, and I'll go to one last quick question from Marla Tellez with Fox 11.
Hello, Dr. Ferrer. Given the increases that we're seeing in cases and hospitalizations, do you foresee instituting any more restrictions?
No, we're right now in a place where, although we're seeing increases that we wish were not happening, and we do have to get ourselves, as we have done in the past, back to slowing the spread again. We feel like with the tools at hand right now and the rate of transmission and the case rates overall, we can continue to just work at improving vaccination rates and getting people to mask up when they're indoors. So we think if everyone can follow the rules that are out there right now and the strong recommendations to be very careful when you're indoors, and there may be people who are unvaccinated or people whose vaccination status you don't know, go ahead and take that extra precaution there. We feel that we have a very good chance at really getting back to slowing the spread. So thanks for that. We'll go ahead now and I'll turn it back over to you, Tim, for Spanish.
Yeah, that's great. Thanks. And if we didn't get your question, we apologize. You can go ahead and send us an email at media@ph.lacounty.gov, and we will get back to you as soon as possible. We'll be doing Spanish remarks at 3 o'clock.